All right, and we're live. Good morning, good afternoon, good evening, depending on where you are, or where and where when you are watching this Facebook Live. This is the voice and the face of Dr. Tolu Olabintan, CEO and founder of Living Spring Family Medical Center in the good city of Mansfield, Texas, where we believe in helping our patients live long and well because we believe the quality of life is just as important as the quantity of life. I'm excited to be here again today discussing another Facebook Live on the topic, Doc, how can I speed up my weight loss? I am here with the one and only Dr. Bukola Esho of Bloomfield Clinic, and I'm so happy to have you here. I know you're busy, so thank you for coming, Doc. How are you?
I'm good, thank you. Good morning to you.
Thank you. All right. For those of you who are watching live, hashtag live, please. And for those who are watching and replay, hashtag replay. And Miss Heather, I see your question. I'll be sure to ask that before the end of the show. Thank you for joining. All right. So I already kind of introduced your name, but please, for those who are watching, who are you and what do you do?
So, like she said, my name is Dr. Bukola Esho. I am an obesity medicine physician located in Frisco, Texas. So, that kind of tells you what I do. I treat obesity. I'm very passionate about it. And in my lifetime, my greatest hope is we can actually conquer this beast called obesity.
That's right, Doc. That's right. Now, inquiring minds want to know, and I'm going to let you spill the beans on this one, but why do you do what you do?
I do this because, as you can tell, I'm very passionate, and I actually found myself in patients. AKA, up to this time last year, I was obese. And as an
Mm.
obese physician, you really get to a point where you want to help yourself. Physicians are known to help other people. At some point in your life, you get to that place where you're like, you know what? Especially when a patient calls you fat, right? As a doctor, yeah, a patient called me that last year. So I got into this basically to help myself because I started seeing myself in other patients,
Mm.
you
Mm.
know, and I would preach to them, you need to lose weight to fix XYZ problem because my background is internal medicine.
Mm.
And I saw that every single year they would gain more weight, and I was following the same trend myself. So I do this, I got into this to help myself and to help other people too, you know.
I love what you do. And, sometimes it seems like as physicians, we're trying to excuse every diagnosis with, oh, you're obese, that's why. But the truth is, a lot of conditions, actually, medical conditions, can be reversed. So when that is reversed,
True.
so for those of you who are watching, don't be discouraged. Sometimes the way it's said may not be nice as it was said to you,
Yeah.
but we do know that quite a few medical conditions, quite a lot actually, is tied to weight. And so when there's that emphasis, we don't mean any harm. We could do it better, but
Yeah.
I'm glad that you could relate to what the patients are going through, and so you could also give them that feedback. Like, I've been where you are, and that makes
Right.
you more relatable. So I love what you do, Doc. All
Thank
right, so we're gonna go right to it. Let's talk weight loss. We know that there are benefits to weight loss, but how do you start? Like, what would you say, Doc? How do you start?
So getting started is actually about acceptance. You know, you need to accept that, okay, I am living with a problem. Because sometimes we're in denial, right? Especially with the body positive movement. As an individual, you have to look into yourself and accept the fact that this extra weight I am carrying. So I'm going to lump two things together, obesity and overweight, because it's kind of like along the same spectrum. First, your normal weight, then you become overweight and obese. You need to acknowledge the fact that it's affecting you. And we know, like you said, the impact of obesity extends just beyond what you look like. And every single time I work with patients, I tell them what you end up looking like is going to be the least of your blessings because obesity affects you, it affects your mental health, it affects your neck, your sleep apnea, chest area, it affects you. If you have asthma, it's going to be worse, right? You don't get enough lung expansion. You can't exercise properly because you can't breathe, when you're working out intensively. Heartburn is going to be worse. Acid reflux get worse. We're not even getting into your visceral fat driving up your cholesterol, driving up type 2 diabetes, increasing your risk for stroke. The cardiovascular things are there, and then it affects your hormones, both males and females, right? And then your knees. So you get to a point where you're like, you know what? I acknowledge the fact that this is affecting my health negatively. And then you seek help, you know.
First, acknowledgement.
Yeah.
Accept, be honest with yourself, as hard as it may be. Be honest with yourself. I'm going to ask the question that Ms. Heather T asked on here. She said, are there any mental tool ideas to use during the non-motivated times? Yes, we hear you, doc. Yes, first acknowledge it. But sometimes I don't feel like going through the next step or even owning up to it or actually going to make the appointment with the doctor to discuss this. What would you say to someone who's saying, I sometimes have motivation slumps?
So it's actually okay. It's actually natural. It's human to get to that point. So you have to get strength from someone else, preferably from your physician, or from a coach. As a matter of fact, if you're going to go through the insurance route to treat your obesity, most insurance companies, when they want to approve or consider approving your anti-obesity medications, they want to make sure the behavioral aspect, the coaching aspect is there. So you're going to need a coach. Think about it. I always use this analogy. It's going to be a journey. It's a marathon. It's not a sprint. Anyone going to win a marathon is going to need a coach. So you cannot self-motivate. This is one of the problems people run into when it comes to obesity. Willpower would never be enough. So you need to get strength from inside you. You need to tap into someone else's strength, especially someone who is trained, adequately trained. The right coach, the right physician is like team effort. And then don't forget, when you become successful, you will be able to self-motivate. So don't expect yourself to fully self-motivate at the beginning or in the middle of the journey. So yes, you're going to need help. You're going to get motivation from your coach or from your physician.
I love that. Don't expect to be there at the beginning. As you get better, you actually it
Yeah.
becomes easier. So don't expect to be able to self motivate right away. Okay, be encouraged, Miss Heather. All right. Next question for you is this: what is the safest speed to lose weight? Is there a
Um,
safe speed to lose weight?
Believe it or not, less is more. And I actually set a target of 5 to 10 pounds a month. Again,
Okay.
if you're thinking about a marathon, you're not thinking. So if you watch the Olympics or major games where they run marathons, you realize most of the time whoever ends up winning, you won't even see them the first few laps of when they're cycling
Mhm.
around the field or whatever they call it, right? So less is more. 5 to 10 pounds steadily every single month is way better than 20 pounds one month, the next month, and then boom, you're down again. If you look at it that way, you give your body enough time to acclimatize to the changes. Because
Okay.
when you're losing weight is not what you look like. You're creating a new normal. Mind you, when you're bigger, your body is used to carrying around an X amount of weight. That's number one. Number two, your appetite control centers in your brain are used to a certain amount of food. Number
Mm.
three, your stomach is used to a certain amount of food to feel full. You don't want sudden changes. And then, of course, number four, the way we look, you don't want loose skin. So I usually set a target of 5 to 10 pounds steadily every single month. It's more realistic, it's sustainable, you know.
Mm.
Yeah.
You adjust to the new normal, and there are other things to consider, like the stretching of the skin as you lose weight. So too drastic may cause. Very good. Thank you, Miss Tiffany. Thank you, Miss Tanisha, for joining. All right, next question. Exercise. Is there a type that is more effective for weight loss? Because we're looking for like speeding up, like we want to amplify the weight loss. So is there a type of exercise that's more effective for weight loss? Would you say, Doc?
Before I answer that question, let me address the role of exercise in obesity medicine. Contrary
Okay.
to what you've seen on YouTube, Instagram, on TV, in obesity medicine, we use exercise for weight maintenance. Exercise is
Okay.
not where we go to lose our weight. So don't get me wrong.
Ah,
Can you lose weight from exercise? Yes. But the amount of exercise is going to take you to shift your weight is going to be vigorous intensity. And your body is a fantastic machine, right? The
I see.
more vigorous your exercise, your body is going to reset you to match. It's going to increase your appetite to make you go in search of more food. So if you dump, let's say, 1,500 calories during one exercise routine, guess where you're going to end up most of the time after the gym? You're going to McDonald's, you're going to Sonic, you're going to somewhere to get some calories back. So now talking about the most effective exercise. My prescription for exercise is your best exercise is the one you can stick with for the rest of your life without a doctor, a personal trainer, a coach, a special program.
Ooh, wait, one second, 1 second. That's deep. So the best exercise, the exercise you could stick to with for the rest of your life without a coach, without a personal trainer. Wow, that's
Yeah.
deep. That's deep. And Miss Tiffany, she said 5 to 10 pounds a month is what she said. Yes.
Yes. Five to
Um.
10 pounds a month. Yeah.
Oh wow, wow,
So
wow, wow.
90% of my patients who work with me only do walking.
Hmm.
Put one foot in front of the other. And believe it or not, the recommendation we stick with is from the American College of Cardiologists, which is 30 minutes, 30, of moderate intensity exercise, 5 days a week. So if you look at it, that comes to 150 minutes per week. So less is more. So look at it this way. If you lost your 5 pounds, you're going to maintain that 5 pound weight loss by walking or doing your moderate intensity exercise, 150 minutes a week. So
Hmm.
it's your weight maintenance tool. Can you lose weight from exercise again, vigorous intensity? Yes, if that's your normal lifestyle, if that's what you're going to stick with forever.
Ah,
Yeah.
if you're going to stick with, it's not just a question of losing weight, it's preventing weight gain.
Yes.
And when Stephanie says this, I love that walking is great and you could do it anywhere. That is correct. You could weave it into whatever you already do at work. If you work from home, get a sit to stand desk, get yourself walking, try to incorporate it in what you do already. So the 150 minutes don't sound like a long
It's not.
time. All right, doc. All right. There's a place or a state one gets to where you start to lose the weight, the 5 to 10 pounds every month, and then it starts to plateau. The weight doesn't go down. And that's very frustrating. A lot of patients have said that. What do you advise then?
Again, I'll go back to one of the first points I made initially: acceptance of what's going on, right? So,
Mm.
believe it or not, again, thinking about it, that your body is a very well oiled machine, right? It needs to put in checks and balances. We call that metabolic adaptation.
Hmm.
Your body is set in such a way that you don't want to free fall. People only get that free fall drastic, weight drop if you're in the ICU for months,
Mm.
if you get cancer, God forbid. So your body needs to put in checks and balances to make sure there's like what's going on. The body is trying to figure out, are we in real crisis or is this really helping us? Because again, you're creating a new normal. So I define a plateau as you living right, meaning putting in your 150 minutes of moderate intensity exercise every week, eating the right foods, doing your coaching, the mind work part of it, being responsible, taking medication if you're doing medication assisted weight loss, and losing 0 pounds. 4 consecutive weeks of losing zero. That's a real plateau. So we're very obsessed about the weight, right? About the scale. We get on the scale every single day. Oh, I dropped to 250 pounds today. And then tomorrow you see 253. And then you're like, oh, I'm such a failure because I go the next 3 weeks and 253.
Hmm.
No. Physiologic variations are normal. Day to day, week to week. You drink more water some days. You spend some time in the sun, you're going to shrink. So you finish doing when you finish doing your yard work in the middle of summer in Texas, that's not the time to get on the scale. You've lost water weight, right? So I tell, a plateau is really going 4 consecutive weeks of living right and losing 0 pounds. So at that time, you should be checking in with your doctor or whoever is taking care of you, treating you in a comprehensive way, right? Now we have to figure out what's going on. Believe it or not, sometimes we step down from vigorous intensity exercise. When you're plateauing, you reduce the intensity. Sometimes we do a food diary because, especially because it's a journey, you find that the wrong foods start creeping in, and then
Hmm.
maybe too much salt in your diet. So we do an analysis. We do a 1 week food diary, figure out what's going on there. And the other thing we'll do is we review your medications. People often ignore the fact that they'll tell you the only things that make you fat come from your mouth. But not
Hmm.
everything is food, not everything is drinks. It
That
could
is
be
so true.
medications. So by the time you put all of that together, again, understanding the process, it's a journey. If you go for consecutive weeks losing 0 pounds, that's a real plateau. Then get with your doctor, come up with you can come up with a plan together. I hope that makes
Awesome.
sense.
Yes, it does. Very, very, very awesome. Remember, these are medical suggestions. It's important for you to get an individualized plan with your
Right.
primary care doctor. I have a question from a patient who actually ties into, or from someone commenting who's actually about to ask the same question I was going to ask. So does insurance typically pay for these visits, medications, and coaching? Because you said a lot of things, coaching, having a coach, starting medications. What are your thoughts on that? And based on what you see, do
So
insurance pay
believe it
that?
or not, coverage for obesity care in the entire country is very sparse. I'm very grateful for for companies that have developed real medications, good medications that work. But the problem remains access, right? Some insurances, as you know, we have like gazillion insurance companies all over
Right.
the country. So there's no straightforward answer. Some would cover only coaching. Some would cover a dietitian, some would cover, medications, and some only cover bariatric surgery. So when we treat obesity, we're looking at 5 things. The one thing you do for yourself most of the time is exercise. There's the diet portion, there's the behavioral coaching, there's medication, and then for those who qualify, bariatric surgery. And of all this, I've never found an insurance that covers all 5, not one.
Mm.
So they would cover some, or they could cover some. Just so you know, 70% of them cover none. So because
70%.
they look at obesity as a lifestyle thing. Is that right? Is that wrong? I'm on the fence about that. But we need to understand that the definition of obesity is a chronic medical condition. It needs to be treated. Coverage might be poor, but there are ways to work around it. Again, individualized, based on your insurance, based on, what you can afford. But everyone can get on something, believe it or not. We get very creative. Yeah.
I like that. We get very creative. We have to help the insurance to help our patients. So, Ms. Trailer, it'd be good to check with your insurance company to see what's covered, because that would definitely help. All right. So there's another question I have tied to medications. It says, there's a fear of medications and being dependent on them. Like,
Right.
doc, I'm going to have to take this medicine and I'm stuck. And if I stop the medicine, that means that all the weight comes back. What would you say to that, doc?
Well, again, I'll go back to the definition of obesity. Actually, the real definition is it's a chronic, progressive medical condition. Chronic meaning it can stay with you for the rest of your life. Progressive means, as everyone knows, it gets worse. You don't even need to be a doctor to know it gets worse. The good news is it's curable. And medications will be one of the things that can actually get us to the point of a cure. But beyond that, we need to remember, you can relapse. You've seen people on The Biggest Loser, they do relapse. You've seen people get bariatric surgery. There's a chance of relapse. So the role of medication is get us to that cure. And if you're working with a doctor, make sure you guys have a lifelong preventative maintenance plan. So obesity is kind of like people who get cancer. Once you get into remission, you don't just ignore the doctor and ignore your health for the rest of your life. As a matter of fact, you're more aggressive than someone who has never gotten cancer before. So if you think of it as whatever I'm doing my doctor right now, usually we create a timeline. Like for a lot of patients, I just tell them 5 to 10 pounds, we do simple math. It's going to take you 15 months, 20 months, whatever. But even in the middle of, at every visit, we discuss lifelong preventative maintenance. If you get into that mindset, right? If you get into that mindset that I need to be on something for the rest of my life. And guess what? It's easier for you to lose 5 to 10 pounds if you're close to your goal weight versus losing 120 pounds. So if you're looking at the preventative maintenance of 5 to 10 pounds, diet and exercise, lifestyle alone will take care of that for you. As far as medications, you have to be on them for life? No. That's the long and short answer. No, you don't have to be on medications for life. We use medications for what they're needed for. You do lifestyle to maintain. Should you need it, right? Because life does catch up to people. That's why people regain weight. It's not because they're lazy. Because for what I do, and what obesity doctors will do is remove that stigma from obesity. Life happens, stress. Kids go to college, you get a medical diagnosis that just makes you gain weight. Menopause is one,
Yes.
Things like that. So you just know that there should be a maintenance plan, and one of the simplest things I tell patients is we get to your goal weight. Your commitment to yourself is to get on the scale once a week for the rest of your life. Once you gain more than 5 to 10 pounds for 4 consecutive week period, give me a call back. You're about to relapse.
Wow, you've dropped a whole lot of information here. I really appreciate you giving all this feedback, all this wealth of information. And so I have people who are watching who are like, this doc is awesome and she's in Frisco. How can I connect with her? Where can people find you, doc?
Well, you can find me locally in Frisco. We're located on Preston Road, one of the busiest roads in the Metroplex. 8000 Preston Road, Suite 401 in Frisco. The zip is 75034. You can also find me on my website, bloomfieldmed.com. And my Instagram would be drb.esho. I would love to connect with you guys. I would love to connect with everybody.
Awesome, awesome. And so what we're going to do is at the end of this live, I will put that information. So for people to connect with you, who want to connect with you as a speaker or as a physician as well, thank you so much for what you do. I've learned a lot just
Wow.
listening to you. So
Thanks
thank you
for
so
having
much
me.
for coming.
Thank you.
Oh, my pleasure, my pleasure. All right, thank you those who are watching. Miss Mitra, I see you, Doc Mitra. Tanisha, thank you. Great questions. And Dr. Tiffany Cook, thank you for stopping by. Appreciate you. And Heather T, thank you for the questions as well. All right, it's a wrap. Please share with those who could find this useful. Sharing is caring. And on that note, if you or anyone you know is looking for an awesome and a thorough and a passionate family physician in the Mansfield, Texas area, I am she. Thank you guys for watching. Bye.
Thank you. Bye bye.